Thoracic Outlet Syndrome. Let's talk about it. Zack Wheeler, a prominent pitcher for the Philadelphia Phillies, was recently put on the injured list because he had thoracic outlet syndrome and a complication of that where he had a blood clot in the vein in his upper arm.
Zack Wheeler's career might be over. The news broke today that he has thoracic outlet syndrome and will be out for the rest of the year and for 6 to 8 months in total. And if you remember, he said he planned to retire at the end of 2027 when his contract expires. Now, even though that's a long way away, it's such a serious injury to the point where he has a tough decision to make. Matt Harvey had the same injury a few years ago, and he was never the same when he came back. But whether he comes back or not, I think we'll never see the best version of Zack Wheeler again.
Thoracic outlet syndrome and the complications that come from it are incredibly rare. In fact, in the general population, it's only about 2 to 4 people per 1,000, and there's lots of different reasons for it. But in overhead sports like baseball, tennis, rowing, the percentages go way up. About 8% of that population can actually end up with this condition. With repetitive motions, such as pitching, you can develop tightness or scar tissue in the area, which prevents the blood vessels and nerves from exiting to your arm easily. The vast majority of people are only going to experience symptoms of numbness or tingling, or occasionally feeling weak, or sometimes they notice their performance comes down. In Zack Wheeler's case, he actually developed a blood clot in the vein because the blood flow was unable to get back to his heart, and therefore stagnant blood equals clotting. Now, to get this, you have to do a lot of repetitive overhead motion. And in Major League Baseball, 9 out of 10 cases are in pitchers, which means that people who are doing throwing like outfielders and infielders, or even tennis players who are doing serves every once in a while, are at much less risk. Pitchers are doing 70 to 100 to 110 pitches on a regular basis, plus bullpens over and over and over again. So if I'm an overhead athlete, do I need to worry about thoracic outlet syndrome? As a sports medicine physician, I think that this is something that is incredibly rare and for the most part is not going to affect most people watching this reel. If you wanted to do things to try to prevent it, you should be doing chest opening type stretches and making sure that you're monitoring symptoms like numbness or tingling or weakness in your arm or a decrease in performance. Because if we get ahead of it, many times we can prevent serious problems. And if we're communicated symptoms, such as when Zack Wheeler had his symptoms, we can make sure that you're getting appropriate care, and he was able to have a thrombectomy where they took the blood clot actually out of his arm, and he'll do much better in the long term. Return to sport is going to be up in the air. He's going to likely have a procedure in which they remove the first rib, which is up here. When you take that rib out, it opens the space and therefore decreases the risk of this recurring. That recovery is also going to be combated with the fact that he may have to go on blood thinners for a little while. We'll see how Zack does. Most people do get back to competition after having this procedure. Wishing him a speedy recovery. I'm happy to comment on all the injuries that are happening around professional sports. So if you find something that you would like me to comment on, go ahead and send me a DM and I'm happy to do a react reel.